I'm happy to be here presenting, and we're going to discuss a little bit about how data sharing works in this context. And I'm going to be talking a little bit about the genomics aspects of data sharing. There are some special considerations when it comes to genomics. And what we have right now is a lot of silos of genomics data that are cropping up all over the world. We have a number of national programs that are interested in genomics and getting started. And we have different constituencies from those focused on different aspects of research in genomics, and the crossover between one research question and another can be another limitation in terms of sharing. Finally, the most important thing is bringing the data all the way from research into clinical practice, and that is a very special challenge. We need to get to the point where every clinician can actually access all of the genomics data that's available. And for that, we need a network of sharing. I was privileged to be one of the founders of the Global Alliance for Genomics in Health, and they tackled this problem quite directly and are continuing to tackle this problem by creating standards that everyone can use for genomic sharing. Currently, they have actually quite a number of initiatives that have been pulled under the umbrella of the Global Alliance for Genomics and Health, and are actively using standards and sharing data internationally. These include cohorts as well as research data sets. The model that's emerged is something that is quite different, and we haven't spoken about it yet. Initially, when we founded the Global Alliance for Genomics and Health, we had hoped to use the model on the left, to aggregate data globally. In fact, moving that into the cloud disperses the data a bit, but is still not enough to get traction and to get people to share the information comfortably. This is an issue of trust. No one trusts internationally a single cloud repository. So what happens is you need to have a data federation. And that means that local jurisdictions remain in control, continue to have jurisdiction over their data, and yet it is shared via moving the compute to the data, which was, Alexander was great in mentioning this. So for example, to illustrate this, you can think about these databases as maintaining the data with standard protocol interfaces that an access program can access. And when you need to do research, you use those programs to access the data where it sits in the different databases under the different jurisdictions. The program is vetted not to violate the consents and appropriate use that have been agreed on, and then that program, which moves from database to database, aggregates results for you. So we're thinking about this as a new paradigm for data sharing, moving away from data copying to data visiting. And this is extremely important. As was mentioned, you can't move a petabyte of data anyhow. One case study that we've had is the BRCA Exchange, and this is an organization that is now global. It was started by the Global Alliance for Genomics and Health. It's collected data on the BRCA gene genetic variants from 32 different countries now, more than 65,000 genetic variants of the BRCA1 and 2 genes. And these are analyzed by another international consortium, the Enigma Consortium, by experts and rated according to pathogenicity. The goal here is that no woman should ever in the future get a result that you have a variant of uncertain significance in your BRCA gene. If we share data, we will understand the genetic variation of this. It's important that in order to understand the impact of these variants, we must share treatments and outcomes. And this is something that Patty was talking about in her beautiful initial talk here in the conference. This is challenging because, of course, sharing patient information on an individual basis is very difficult. But what we really need is variant summary level data that is accompanied with summaries of treatments and outcomes. So the way this is working in the federated analysis is that instead of gathering all that patient level data into one place, which is hopeless in this case because there isn't international trust for sharing all of that individual data, we actually run the analysis software within the individual jurisdiction healthcare systems, and they are the only ones that actually have direct access to the patient level data. And this is now working, for example, concrete in working with BioBank Japan. You can see how the Docker container, which contains the code that is validated and completely portable, shipping to Japan was able to get the results that we needed out of the individual level data without actually transferring that data out of country. Second case study was the California Institute for Regenerative Medicine, and this really was something that was started pre the Global Alliance for Genomics and Health. And in a sense, it is a cautionary tale. We worked for them. We built the database for all of the stem cell information for the California Institute for Regenerative Medicine, working with 18 different California Institute for Regenerative Medicine labs, collecting 84 terabytes of data. But you see that 66.7 of those terabytes is currently publicly available, and the rest is pre-publication. Okay, so this is a little bit of a cautionary look at the numbers. The holding on to data for a long time before publication is a major, major issue. And that's, I think, what this initiative is pushing hard on. Nevertheless, while the data are still pre-publication, we have cell browsers that look at the RNA expression pattern from single cell data sets. We have the Genome Browser, which looks at a number of data sets and is used by about 20,000. It's used by about 10,000 different human genetics researchers every day. And these tools can give you an early snapshot of many, many data sets. And we can make arrangements so that pre-publication data is easy to be shown on these, and hopefully with appropriate mild embargoes and a consideration of rapid full publication of the data. All of these are in the data biosphere in the future, we hope. And there's a specific project that we're working with, and many institutions now are working with at NIH, called the Data Biosphere. It's important that NIH be able to share data from all of the different hub and spoke projects that Patty described, the data coordination centers. If they can use a common cloud framework, will be much more interoperable. We have to avoid the issue where every NIH institute and every project within every NIH institute has its own organization of the data in the cloud. We need a common cloud organization, and Data Biosphere is well on its way to creating that. So the last thing is SARS. As you know, the papers, as Patty described, the papers are exploding in terms of numbers. We now have 1.2 million genomes sequenced, and those data show the increase in variants dramatically. Here's the B1.1.7 growing very fast, but this actually broke all of the software that is being used to create phylogenetic trees. So this tree coming out of NextStrain is built on about 3,000 or 4,000 samples. That software can't handle 1 million samples. We were able to do a tree with 1 million samples in it, and we allow you here at Santa Cruz to upload your new data and match your data to the tree of all SARS genomes. But we ran into a problem because of decade-old data sharing agreements. We were actually at one point asked to cease and desist based on this. And that was a surprise to me, but digging under it, there is a real root here. We have hardworking, underfunded scientists all around the world contributing data to this outbreak, and they definitely deserve better recognition and reward for what they're doing. We just need to have a procedure there where they're getting that recognition, say early publication in bioRxiv, without having unnecessary restrictions on the data, so that in the middle of the pandemic, you're not asked to stop your work on that data. And finally, when we extend the human genome from one reference genome to a set of reference genomes that represent all of the ethnic diversity in the world, the Human Pangenome Reference, as the NIH has now embarked on as a project, we have to do better than the 1,000 Genomes Project. The 1,000 Genomes Project was great in that it represented genetic and geographic diversity, had availability of the resources, not just for the genomes, but low passage cell lines, but it didn't have strong enough regional scientific partnerships. And that's the key. The most important issue in data sharing is respect, and it's respect for those who make the science possible by contributing data. You have to deal with all of the great people who are out there generating the data on their own terms. At the same time, that respect has to be earned by an equal amount of generosity. Thank you.